Vitamin D is also known as the sunshine vitamin. Now, this is a very important vitamin because it works with calcium and is especially beneficial to the elderly for preventing falls or at least minimizing the damage. Hi guys, I'm W.F. Chong, your U-turn naturopathic doctor. Cholecalciferol is another name for vitamin D. It is a fat-soluble compound made of steroids. It can be described as steroid hormone. Cholecalciferol D3 is found in animal products and fish oil. The ergocalciferol D2 is found in plants. However, D3 is more effective than D2. What are the functions of vitamin D? They are responsible for cell proliferation, differentiation of cell and the growth. It also plays the differentiation of stem cells into osteoclasts to facilitate the bone resorption. It also inhibits proliferation of lymphocytes, keratinocytes, the cardiac, skeletal, smooth muscle cells. It also stimulates calcium and phosphorus absorption in the intestine and reabsorption in the kidneys. It also releases calcium from bones back to the blood when it is needed. It inhibits the bone resorption in bone modeling and remodeling stages. Vitamin D helps calcium absorption. It reduces the risk of osteoporosis. It helps to maintain the smooth and skeletal muscle strength. It is also involved in the brain physiology, like the synthesis of various neurotropic factors such as neurotransmitters, including acetylcholine and catecholamines. It plays an important role in immunomodulation. It enhances the immune responses to bacteria and viral agents. It suppresses cytokine production and the release of it. It reduces the propensity to autoimmune conditions such as rheumatoid arthritis. And vitamin D influences glucose homeostasis and insulin sensitivity. Now, vitamin D deficiency can be of concern because vitamin D deficiency may cause the following: rickets, stunting, osteomalacia, osteopenia, osteoporosis of course, and sarcopenia, skeletal muscle weakness, atrophy, cardiovascular disease, peripheral vascular disease with claudications. There are increased susceptibility to microbacteria and viral infection. Vitamin D deficiency can also cause impairment to the glucose-mediated insulin secretion. It can also cause anemia and also produce chronic lower back pain. Now, who are at risk of vitamin D deficiency? Those who constantly use sunscreen every day, people who have insufficient sun exposure due to hospitalization, or clothing with headscarves, long robes, and also people who are staying in countries that seldom get the sun. Now, people with naturally darker skin have higher concentrate of melanin. Now, these groups require 3 to 6 times longer sun exposure compared to their other parts of the face skin. Okay. Now, the obese is another group because the fat cells may secrete out the vitamin D. Those on medication such as orlistat, corticosteroid, anticonvulsants are also at risk. And of course, the elderly are the most at risk one, and the vitamin D production decline with age, unfortunately. Breastfeeding mothers are also at risk, especially if they are already vitamin D deficient. They increase the risk of the infant having poor bone formations. Those who have gone through gastric bypass, they are also vulnerable. And those who have chronic liver and kidney disease patients, they may have compromised vitamin D metabolisms. Those who have inflammatory bowel disease and other fat malabsorption conditions are also at risk. Now, besides the sun, where else do we get vitamin D? Now, wild-caught fatty fish such as cod, they have plenty of vitamin D. Do you know that 2 eggs contain 82 international units of vitamin D? And 1 tablespoon of cod liver oil contains 1,360 international units of vitamin D. Now, 85 grams of canned tuna contains 154 international units of vitamin D. Now, vitamin D is highly compatible with calcium and vitamin K2. Some supplements may have all combinations in one capsule. Now, there are some contraindications and cautions regarding vitamin D3. Now, the ingestion of 50,000 to 100,000 of international units per day may cause nausea, vomiting, or poor appetite, and a frequent urination. Sometimes may cause muscle pain, tiredness, and headaches. It is also contraindicated in people with hypercalcemia. Now, there are possible interactions with medication such as anticonvulsants and antiretrovirals, atorvastatin, budesonide, cimetidine, heparin, orlistat, sirolimus, and thiazide diuretics. Please consult a healthcare professional if you have medication and thinking of taking vitamin D3. Never take medication with vitamin D3 at the same time. They should be separated by at least 3 hours apart. Thank you for watching. Please consider subscribing and giving this video a thumbs up if you like it. Let me know your thoughts in the comment section below. And in my next video, it is about an exciting plant that has immune modulation, antimicrobial, and anti-inflammatory properties. See you next time. Remember, take control of your own health.